Are you expecting a baby? Well, congrats! It is important that you, mom, should know how to avoid infections. This is because some infections can be more severe during pregnancy or may harm both you and your baby. It can cause serious illnesses, birth defects, and lifelong disabilities, which is why it is important that you, mom, should take extra steps to avoid infections during pregnancy in order to improve the chance of your baby being born healthy. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems in order to raise happy and healthy kids. In this video, we will talk about the 9 steps that you can take to avoid infections during pregnancy. Avoiding infections during pregnancy. First step, hand washing. Hygiene is important, so hand washing is essential and most effective in preventing the spread of infection. Remember to wash your hands before and after touching raw food or after eating, after going to the bathroom, after changing your child's diaper, or after wiping your child's drool or runny nose, after picking up the garbage, and after touching animals or pets. You should wet your hands and use an antimicrobial soap and rub it together for at least 20 seconds. You should pay special attention to the fingernails, the areas between the fingers and the wrists, and you should rinse thoroughly. If soap is not available, you can use an alternative alcohol-based hand gel. Another way to avoid infections during pregnancy is to reduce contact with urine and saliva of babies and young kids. This is because a virus known as the CMV or the cytomegalovirus can lead to microcephaly and hearing loss. When a woman is infected with CMV, she can pass it along to her developing baby. So to reduce the infection, you should avoid sharing food and utensils with your baby and young kids. And always remember to wash your hands thoroughly after changing your baby's diaper. Food safety is important during pregnancy in order to avoid infections. So you gotta be careful with unpasteurized milk, raw or undercooked meat, fish, shellfish. Also be careful with unpasteurized juices, cold deli meats, and salads because these can contain bacteria that might harm you and or your baby. And when eating raw fruits and vegetables, make sure you wash them first. When pregnant, you need to take precautions in order to decrease the risk of acquiring insect-borne illnesses, especially the mosquito-borne infections like the dengue virus, malaria, Zika, and West Nile virus. In order to prevent mosquito bites, you need to wear protective clothing, use screens or nets in areas where there are a lot of mosquitoes, and try to avoid being outdoors at times when the mosquitoes are most active, and use a DEET-based insect repellent, which has an excellent safety record. Do you want more tips on how to avoid infections? Well, before we go to that, do you have a newborn baby? Or you're expecting a baby? How much better life can be when things are under your control upon baby's arrival, where you immediately feel confident about breastfeeding your baby, when you know when to worry and call the doctor, when you know how to soothe a crying fuzzy baby, when you can understand your baby's sleep schedule so that you can better take care of your baby and better take care of yourself. How much better life can be when you can get the training in the comfort of your own home. I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. So are you thinking about travel during pregnancy? Take note, you should avoid high-risk areas in order to minimize the risk of getting infection like the malaria or yellow fever or the Zika virus. There are also areas at increased risk for food and waterborne related infections that, for example, can cause acute gastroenteritis that leads to symptoms of vomiting and diarrhea. If you plan on traveling internationally during your pregnancy, it is important that you talk to your doctor about it, especially those infection-related illnesses in your planned destination. We also need to consider sexually transmitted infections. You, mom, are at increased risk with a sexually transmitted infection if you have more than one sexual partner, or if your partner has more than one sexual partner. Avoid having sex with your partner if your partner is showing signs of a sexually transmitted infection, such as discharge, or if there is pain when peeing, if there are blisters or sores. Some people can have an HIV infection or hepatitis infection or a sexually transmitted infection without feeling sick. If you're concerned about this, talk to your doctor about it in order to protect your baby. It is important to avoid airborne infections during pregnancy. An airborne infection is transmitted when a person inhales droplets from an infected person's cough or sneeze. In order to prevent getting this infection, minimize contact from an ill person and use a mask and with frequent hand washing as well. Stay away if you know a person has chickenpox or the rubella infection. Animals can also be sources of infection during pregnancy. So in order to avoid infections from animals, avoid contact with rodents, even pets like guinea pig or hamster. And avoid changing the cat litter boxes as well and have another person do it. And in order to prevent infections during pregnancy, it is best that you are up to date on your immunizations even before pregnancy. There are some vaccines which can be given or should be given during pregnancy, and this includes influenza or the flu, for pertussis, COVID-19, and the hepatitis B vaccine. Also, other people in the same household should also be up to date on their vaccines, including kids. Hey, if you found this video helpful, how about you share it with 3 of your friends who might need it? And if you enjoyed this video, watch my next video where we talk about other child health problems.